officials are alerting the public about an increase in non-COVID-19 respiratory illnesses that are seasonal viruses that we typically just don't see in June.
Uba Ali shares how you can stay safe and protect others.
As we begin to get back to some form of normalcy and we take off our masks, health officials are alerting people of an increase in seasonal viruses.
We have seen a major spike over the last few weeks of 60, 70, or even 80 kids who are coming down with this.
Those numbers are just within the state. DHS respiratory disease epidemiologist Tom Hout says nationally, children under the age of 5 have been contracting parainfluenza, a virus that normally would not be seen.
RSV and coronaviruses are winter viruses. By now, they should be gone. The peak activity would have been back in February. Some of these viruses have not been seen for over a year and a half. And they're just starting to emerge again.
The significant increase is the reason behind the health alert and an opportunity to remind people COVID-19 is not the only virus around. Across the state, 60 to 80 children have come down with influenza. While he can't specifically say the cause of the increase, he believes the safety measures the world followed during COVID-19 could help, such as washing your hands frequently.
We had asked that if you're not feeling well, wear a mask. We are used to wearing a mask for the last 19 months. It's nothing any different. Stay home, stay away from work. Do not send your children to daycare centers. Limit yourself the time that you spend with people at high risk.
Some children have high fevers, a cough, or rapid breathing. Hout says the symptoms can vary from mild to pneumonia, landing some children in the intensive care unit. While the state has not seen a major outbreak in congregated settings, health officials want to remind people to stay vigilant because none of the seasonal viruses have a vaccine. Uba Ali, TMJ4 News.